So my name's Sam Glee. I'm the Senior Clinical Nurse Specialist for the Big C. I've been doing breast cancer specialist nursing since 2010. I've had lots of different experience with breast cancer patients, from seeing them from first diagnosis through surgery, through different treatments, and then helping them living with and beyond their cancer treatment and supporting them that way as well. So through my experience and a lot of feedback I've got from patients in the past is that us ladies and gents will forget to check ourselves on a regular basis, and having a whole month of awareness just draws people's attention back to making sure that they do check their breasts. So when you're checking yourself, it's always best to use the flat of your hands in the shower when you're nice and soapy. Your hand will smooth over the tissue area easily then. Don't ever use the tips of your fingers. Everything feels like a lump and a bump when you use the tips of your fingers. They're very sensitive. So soap yourself up, and then with the flat of your hand, go over your breast tissue, but also go over your chest wall as well, and under the armpit. And I can't recommend enough flats of the hands. If you recognise any changes, so for example, lumps, swelling, any thickness within the breast or the chest wall or the armpit, definitely get those checked. Some of the misconceptions around breast cancer are that people immediately think they're going to have a breast removed, so a mastectomy, and then also they think they will always develop lymphedema, swelling of the arm and chest area. They often think they're going to die and it's a death sentence, whereas a large amount of people survive breast cancer these days. It's a very well researched area, so we're quite lucky within breast care that it is so researched, so therefore the treatments are very well targeted these days. I would just like to recommend people coming to the Big C, especially once they've had their diagnosis, in order to get that support, information and guidance. If anyone has concerns about what type of cancer they've got, I would encourage them to come and speak to a member of staff at the Big C to be able to go through it with them. Any breast cancer patient that comes to the Big C, they can be offered my services as being a breast clinical nurse specialist for that support and information. And obviously we've got other nurses and support and information officers for people to talk to.